Okay, so it looks like we are recording. And all right, we'll just get started here. So hello, everyone. My name is Matthew Stein. Some of you will probably know me that are watching this video. I am a serial entrepreneur, generally a health enthusiast. I would say I'm an amateur biohacker and neurohacker, definitely also a foodie, and just a generally curious individual about all things related to health and regenerative medicine. And so I've been talking recently with many of you who know me about the topic of stem cells and exosomes specifically. And quite honestly, exosomes has been something that's relatively new for me. I learned about it recently through Ben Greenfield and the Joe Rogan podcast, and then just heard about all sort of these miraculous stories that were happening from exosome treatments. Brought it up to Dr. Haas, who's with me here on this interview, and we started talking about it as well, and I just got genuinely curious in it. And then Dr. Haas also started offering exosome treatments at her facility. And so as I've been sharing more, as I've been learning more, I really just wanted to do this interview here to educate myself and also anyone out there who is interested in learning more about exosomes specifically. And also wanted to share that I've recently done an exosomes treatment and share a little bit more about the results and benefits I've been seeing thus far. But first, please let me introduce everyone here to Dr. Korianne Haas. Quick background on Dr. Haas. She is a licensed physician and surgeon and board certified anesthesiologist. She opened her own general medical practice right here in Encinitas, which is called Flourish Anti-Aging Medicine. And she specializes in regenerative medicine and anti-aging medicine with a focus on medical ozone therapies, including prolozone, high-dose autohemotherapy, PRP, stem cells, exosomes, and other injectables that are really the cutting-edge medical technologies in regenerative medicine. A little bit more, she's studied under some really well-known doctors in medical acupuncture, oxygen healing therapies, functional medicine, and naturopathic medicine, including Dr. Frank Schallenberger, Joy Kong, Derek Lawrence, Robert Thompson, just to name a few. And also, Dr. Haas is just an all-around great human being and friend. And so welcome, Dr. Haas. Thank you for taking this time with me. Really appreciate it. And I'm excited to jump in and learn more.
Thanks so much, Matt. It's my pleasure. Happy to be here with you as well.
Awesome. So just to touch on the first thing, what opened my eyes to this world of exosomes was, like I said, first I saw something from the Ben Greenfield podcast with Joe Rogan, and then I just started doing some research. I've known about stem cells for a few years. I also got a stem cell injection in my knee a few years back, and it really worked, and it was pretty amazing. So I was impressed with that and the results that I had there. But then this exosome thing has been relatively new. Even today, not a lot of people have heard of it or know too much about it, even people that are familiar with stem cells. And so what blew my mind was when I saw Dr. Doug Spiel, who is, I believe, the chief medical officer for a company called Chimera Labs that actually sells these exosomes, him just sharing some of the anecdotal experiences he's had with his patients. And the one that blew me away the most was he had a patient who was paralyzed for 7 years. He was quadriplegic, gave him an intrathecal injection of exosomes, about 45 milliliters, and within miraculously 3.5 weeks, he went from being fully quadriplegic to being able to move his legs enough to do like squats on a flat bench in his physical therapy routine and regimen. And I was just like, that almost doesn't make sense. How is that possible? But then that was just one of his patients. He's had that result with a few of the patients that he talks about in his seminars and his his speaking engagements. And so really just mind blown. But it's not just tissue injuries. It's all sorts of things. It's autoimmune issues and just general like cell health and regeneration of your entire body and anti-inflammation. So I'm probably not the best person to really speak into that. I'm just like, this is what I've gathered from my research. But maybe Dr. Haas, you could share a little bit more like, what are stem cells for those of us who aren't familiar? What are exosomes and maybe just like what they do in the body?
Yeah, awesome. And that's a great intro. I actually became really excited about exosomes because of Dr. Spiel and his results as well. I mean, there have been a lot of studies on stem cells, and there have been a lot of benefits that have been shown. I mean, a huge amount. And there's tons of research going on right now with stem cells and exosomes, also known as extracellular vesicles, EVs. And no one had been able to reverse quadriplegia before in people with these old cervical spine injuries. They tried it with stem cells. They got a little bit of benefit, but even under the best circumstances, they were not able to get the results that Doug Spiel has gotten with his exosome injections, which he is doing actually injections in the neck, the fluid surrounding the spinal cord in the neck, as well as an IV infusion at the same time. So that really got my attention. So what are stem cells and what options are available to people here in the States? So basically stem cells are, depending on where you get them, they're able to proliferate and regenerate and form new tissues. So really great example I like to use is human bone healing. So when you break a bone, the surgeons just put it back together, right? But your body's able to heal that bone, and then they can come back and take out those rods and screws and pins. So how does that actually happen? There are resident stem cells in every part of our body, and as they went there when we were very young, and they've aged with us. So we have stem cells in the bone marrow, and those, when they're stimulated with the right circumstances, so obviously in a bone fracture, there's going to be all kinds of signals going on with inflammation and healing and blood clots and all that sort of thing. And it actually stimulates our resident stem cells to go there and differentiate and form bone cells. So that's a example of what stem cells can do. We have them in our kidneys, we have them in our heart, we have them in our brain, we have them in our fat, we have them in our bone marrow. The example that I just gave is one of the things that bone marrow stem cells can do. So people have been excited about using stem cells in the United States for regenerative purposes and for anti-inflammation, for treating autoimmune disease and chronic disease. And there are clinics where they take fat. So they do mini liposuction and they take the fat and they extract the stem cells from the fat. And then a lot of other places are taking bone marrow aspirations and extracting the stem cells from the bone marrow. And then the other option is getting birth tissue products. So these stem cells are obtained from placentas, umbilical cords, amniotic fluid, the membranes of the placenta. All of those things are very rich in very young stem cells that have the potential to do a lot of different things. So the stem cells in your bones, for example, are pretty limited, that they can take care of blood vessels and bones and things like that are in the near vicinity, but they're not going to go to your brain and help you form new neurons, for example.
Right.
So the birth tissue stem cell products have more ability to do different things. And one of the specific types of stem cells that people are really excited about, that a lot of research has been done on, is called MSC. So that was originally because they're mesenchymal stem cells, and mesenchyme is one germ layer. So there's the endoderm, the exoderm, and the mesoderm, and that's the muscles and nerves and a bunch of other tissues,
Yeah.
basically what the meat of our body.
Exactly.
Go ahead.
And I keep hearing about like these mesenchymal, mesenchymal. It's like potato. It's like some doctors say it different ways, right? But generally, they're referred to as MSC stem cells, right? And so, and I think you were just going there, but maybe you could share a little bit how these MSC stem cells are different from regular stem cells.
Okay, great. And I could be pronouncing it wrong. So I'm a big reading nerd, so I read a lot. I don't necessarily listen as much as I read. So
Yeah.
I sometimes pronounce things differently because they look different on paper. So it could be
Sure.
mesenchymal. Um,
Exactly.
it doesn't really matter, I think. But
MSC.
basically,
Yeah.
MSCs is the best way to put it. Yeah. So they've been just found to have regenerative properties in a wide variety of places, in a wide variety of situations, from, deafness in mice that were given a
Wow.
toxin to make them deaf. They actually regrew and were able to hear again, regrew parts of the ear cell. Heart attack, with the dead tissue turning back into functioning myocardium tissue. I mean, neurogenesis, you name it, skin, wound healing, ulcers, and then also autoimmune disease, things like type 1 diabetes, multiple sclerosis. So they've kind of isolated that these cells are kind of special because they have a wide range of benefits.
Yeah.
But what I was getting at was, they call them MSCs, and it used to be because of the germ tissue layer that they came from. But then the guy who actually originally named them decided, well, they're actually master signaling cells. They could do more than just make mesenchymal tissues. They can actually, they can form other tissues from other germ layers. So what they really do is they send out signals and they cause this whole cascade of healing, wherever they go, depending on what's needed. So he actually renamed them master signaling cells. So MSCs are also known as master signaling cells. So, and they are actually found when we get birth tissue stem cells. The best part of the birth product to get the most MSCs is actually in the blood vessels near in the umbilical cord. So the umbilical cord has arteries carrying blood from the mother to the fetus and nutrients, and then also the veins to take the blood back to the mother. And those perivascular MSCs seem to be the very best and most potent cells, and they're hard to extract. And so you can go to Dr. Reardon's clinic in Panama, and they're actually culturing these cells. So they actually use enzymes to dissolve the cord matrix to get the MSCs and isolate them. And then they stimulate them in a culture to divide and expand. In the United States, if if you want to be in compliance with the FDA, you actually need to not use some of these dissolving agents, these enzymes, and you're not able to expand them and culture them. So what they're doing is they have to very carefully extract the MSC stem cells from the umbilical cord, and they, a product that I like, they actually mix it with different tissues and some of the amniotic and some of the cord blood, because you get a bunch of different cell types, and they all seem to be very beneficial.
Yeah. And
Um,
I'm
but
curious.
that was a bit of a tangent.
Yeah, no, it's
Uh-huh.
okay. I'm curious because, yeah, Dr. Neil Reardon is obviously one of the more prominent names in the field of stem cells. And I also saw him
Oh
on
yeah.
the
Uh-huh.
podcast. But, I'm curious, just based on what you just shared, do you think that because his clinic in Panama is able to do some things that maybe aren't allowed by the FDA, are they more efficacious? And also, like, my understanding is, like, you take a trip down to Panama, it's going to cost you just whatever it costs you get there. But then to work with him, it's like 20, 30 grand for this type of
I
treatment.
think it's 30 grand and he reached out to that clinic a couple years ago, and he just wanted a shoulder treatment, and they said, well, we're going to inject your shoulder, then we're going to give you 2 IVs. I think it was a total of 160 MSCs for his visit, and it was a 5-day stay, and it was $30,000 for the treatment. So I think you're kind of looking at a minimum of 30 grand, and that was a couple years ago, and I think he's more popular now.
Yeah.
That's really a great question. So if you get unexpanded stem cells, so that means they haven't been put in the culture and asked to divide. So they've actually studied what happens when they divide and divide and divide, because they're making these exosomes. We're going to get to that eventually. They're making these signaling factors, and every cell of your body, probably the healthy ones, the inflamed ones, the cancerous ones, the elderly ones, they call them senescent cells. They're making exosomes. They're signaling other parts of your body near and far. And some of these exosomes are very beneficial, and then some of them are actually bad for us. So cancer can have bad effects on neighboring tissues based on its signaling cells. And these senescent cells, if you've heard much about that, they're basically poisoning your body. You want to try to get rid of those. And so there's a bunch of different ways that you can do that. But so after you start expanding cells, after a certain number of divisions, they get to a point where they're actually starting to change what their signaling molecules they're secreting. So I think I don't know exactly what he's doing there, but I think he knows what he's doing. So I think he's expanding them to the point where they're still really beneficial, but you get as many as you possibly can. I think that he's able to keep them fresh and not have to freeze them. And I think that's a big issue with the US FDA compliant stem cells. They have to freeze them, and they have to freeze them to very cold temperatures, so colder than dry ice. If you really want to keep them fresh, they're hugely cold. They go in these special cryogenic tanks. And they have a very special process where they slowly freeze these stem cells. And then they ship them overnight on dry ice. You use them that day, or you can spend a lot of money and get a really special freezer that will keep them that cold. Or you can put them in a liquid nitrogen tank. Those are also available, and that's a reasonable thing to do if you're going to store them for not a super long period of time, but it's a reasonable thing to do. And then you kind of shock thaw them in the office. And, you mentioned I trained with Joy Kong, and I was pretty impressed with her, everything she said. And then I kind of started to rethink a lot of it since that time. But basically what you do is you take them out of dry ice and you hold them in your hand, and in like 4 minutes they're thawed, and then you just draw them up, mix them with saline, or I actually use Biocean marine plasma, which is a better isotonic salt solution that has trace minerals and good energy and all that stuff. You mix those together and then you inject that. And so they will send you, these stem cell companies will send you their reports about how many of their stem cells are viable after they've been thawed, and they look pretty impressive. But in reality, you're probably losing at least 50% of the live stem cells by going through the freezing and thawing process. So I think so. I mean, it's hard to tell because the way they study them in ideal conditions, and the way that they tell you to use them in your office is not exactly ideal. Yes. So I think you're probably getting a lot less alive stem cells than we've been told that we're getting when you're freezing and thawing them. So that makes a big difference.
Yeah, and that's actually
being said, if you work in a lab.
Oh no, go ahead. Sorry.
Yeah, go ahead. I was just going to say, if you work in a lab and you're doing these research studies, you get fresh umbilical cord stem cells. Those, if they're non-expanded, they are definitely more potent than the expanded ones. There definitely seems to be some clear evidence that that's true. And when you think about it, every time if you expand a cell, stem cells don't just produce duplicates of themselves, they produce daughters. So there's the mother and then the daughters is the way that they term it. So that if you can just get that parent one and get a lot of those, they may be 10 times as effective as, 10 expanded. They may be as effective as 10 expanded stem cells, for example. But if you have to go and freeze them and then thaw them out, that's a big difference too. So it's a good question.
Yeah, thank you. And so that's actually a really great segue, I think, to the exosomes conversation, because one of the questions I had for you is like, where do these exosome products on the market come from? And my understanding, and this is from some of the research that I've done. You can correct me if I'm wrong here, but basically the company Chimera Labs, they go out, they recruit women who are undergoing a cesarean section. They screen them for basically every imaginable communicable.
I'm going to correct you there.
Genetic disorder. And then
I'm going to have to correct you there. They actually are not getting multiple donors. They have had the same, they call it the mother placenta. So they basically got this, they found this perfect donor, and then they did all the tests on them, and they've continued the same line. So they haven't had to continue to get new donors, actually. It's all these treatments from the ones that Doug Spiel has done that you were impressed with the quadriplegic.
Yeah.
It's the same line of stem cells from the same placenta, the same birth products.
Okay, cool. So thank you for that correction. So they So then they have this
Yeah.
one placental donor. They take the stem cells from that placenta. They what's called culture expand them to hundreds of millions of stem cells. They put them then in a stressful culture medium. They essentially, what I understand is that they're almost tricking the stem cells into thinking that the host is under duress. And then these stem cells then sprout these vesicles, which are the exosomes, I imagine, that are filled with growth cells, which is like the good stuff. Then they kill the stem cells to get rid of the nucleus and the actual DNA from the cell. And then you're just left with these exosomes that are ready to do their thing in the body, right? Is that essentially how it works?
Yeah, pretty much. So the way that I understand it is that they continue this culture line. So they keep the stem cells going, and that must be through culturing and expanding them, which is interesting. And then they collect the extracellular vesicles. I don't know that they necessarily kill the stem cells, but they purify them. They highly purify them, and they're looking to make sure they're within a specific size range. So we're looking for a specific size of vesicles, and
that's like 40 to 100 nanometers, right?
Yeah, and they know these particular types of, they call them the vesicles or the exosomes. They don't contain the cell membrane, but they contain a great kind of lipid. So they're in a lipid bubble, and it has these beneficial lipids. So I don't know what they're feeding their stem cells to make them produce these wonderful things, but they have things like ceramides and sphingomyelin and all these wonderful things that you'd want to supplement with to be for you to be healthy. And that's what's on the outside. And then what's on the inside is these proteins, these amazing signaling factors. So such things as BDNF, so brain-derived neurotrophic growth factor. And they're specialized. So these exosomes were made with a specific cargo for a specific target. So for example, one made for neural regeneration may have some BDM, quite a few copies of the BDNF protein. And it also contains micro or mRNA, which will actually, so this is how it works inside the cell. You have DNA, you have chromosomes. Some of them are turned on, some of them turned off. When they're turned off, they're wrapped up really tightly around these things called histones, and they can't be transcribed to make RNA. So RNA is the messenger. Then it goes to a different part of the cell where it's read and turned into proteins. So you're getting a bunch of these proteins to kind of jumpstart that target cell. And then you're also getting the mRNA, which will go to that little protein factory in your cell, the endoplasmic reticulum, and will now produce hundreds more of the proteins that are desired in that target cell. So it's pretty incredible.
That sounds pretty incredible. You're just like bringing up all these terms that are reminding me of biochemistry in college, and so just like kind of bring me back.
You remember the endoplasmic reticulum?
I do. Endoplasmic reticulum. That's
and those histones.
Yeah, that's one of those terms. I'm just like, yep, I remember that one. Don't remember exactly, but I certainly remember that phrase. And
one other thing while we're talking about that, histones prevent your DNA from being transcribed. So they're basically turning off the chromosomes. And some exosomes from these MSCs actually have something called histone deacetylase. So it can actually go to the nucleus, go to the DNA, and actually open some of those genes back up. So those genes can start being transcribed again. So that's pretty fantastic, I think.
That is phenomenal. Yeah, actually, let's touch on that for a second, because my understanding, that's actually one of the benefits of an exosomes treatment versus stem cells is you're actually not getting the donor DNA from the stem cells when you're getting the exosomes, and then the exosomes actually are able to do exactly what you just said. So maybe you could just touch on that a bit.
Yeah, definitely. So I've, I started working with stem cells before I really got delved into exosomes. And for some reason, I thought exosomes were going to be exorbitantly more expensive than stem cells. So I thought, well, let me just start with stem cells. And then I found out, well, actually, exosomes are significantly less expensive. So that was when I kind of just dove headfirst into this, because I want to provide this to as many people as I can. And anyway, they are less expensive, and I think that they're safer. And I think based on my experience so far, compared to the birth tissue products that we have available to us on the market, and there are actually drawbacks to doing fat and bone marrow stem cells as well, which I'm not going to get into here.
Sure.
So we probably have a lot more to talk about. But the amount of exosomes that you can get, so I'm using Chimera's products. And you asked earlier where else they get them from.
Yeah.
And so just to touch on that briefly, there are some other companies where they're just taking amniotic fluid. So the fluid that the baby swims in is full of exosomes. So that's why you can do surgery in the womb and then the baby can be born with no scar. I mean, they're just floating in a pool of exosomes.
Yeah,
and actually using amniotic fluid. Yeah, they've actually dehydrated amniotic fluid. You can inject it into joints and soft tissues for regenerative purposes. And there's places in India where they're taking the placenta itself and just putting on burns, major burns, and they're healing. So these birth tissues are pretty magical. But that's another source. So what they have to do for that is they do, screen the donors and they do a questionnaire and then they look for certain diseases. And then they attend the cesarean section and they actually take the amniotic fluid. They first open up the uterus to get the baby out. And then they're purifying those exosomes, and those are a product that is offered as well. And then I've just heard about a company who's doing it from adult bone marrow stem cells. So I haven't contacted that company yet. I mean, I really want to stand behind. I mean, I want to be with the company that has the most legs to stand on since we're in such a new realm. But I have to confess that I have received both the Chimera exosomes in an IV form. And then I did do some amniotic stem cells as a brain regeneration. It was actually a nasal injection that a friend of mine did. And they offered me these exosomes for free, so I couldn't say no. Right? But I got 2 milliliters of that product. Yeah, exactly. Why not? But I really like Chimera because they have had that same tissue line for so long. Yeah. And these are really great birth tissue stem cells. I'm definitely interested in what else is out there, but until they can make somebody that's been quadriplegic for 7 years start doing squats, I'm probably not going to switch.
Right. Well, so let me just pause you there for a second, because you just kind of went right through the fact that you got an injection intranasally into your brain, and like that's pretty I would say sounds risky, right, if you don't know what you're doing, but clearly you do. And so me personally, who gave me my exosome treatment, I just got it intravenously, but we've talked about a few different things. We've talked about intrathecal injections in the neck. We've talked about the intravenous now, and then intranasally. What are some of the other ways that people can receive these treatments? How can they be administered, or what's typical of that in your experience?
So I really like doing the IV, and I am jumping around here a little bit, but when I was talking about how you find the MSCs around the umbilical artery in the umbilical cord going towards the baby, I used to think that the reason they were positioned that way was so that when the baby somehow signaled them, said, hey, I'm trying to grow a bone here, I'm trying to grow some more skin, that the MSCs would actually migrate into the blood and travel to that part of the baby and cause that to happen. But then I realized once I started understanding the paracrine and endocrine effects of exosome signals, I think that these MSCs are hanging out by the artery just so they can send the signals. They don't really have to even go anywhere. That's where they are. And in adults, our highest concentration of MSCs is around blood vessels. And they will migrate into our bloodstream and go to different places under certain circumstances, but probably a lot of what they're doing is they're actually signaling your body kind of like an endocrine gland. So anyway, I like the IV technique because we know that we have a wide range of cargoes with a wide range of targets, and there's the 5 milliliter dose of Chimera exosomes that I'm recommending to do IV. So people are doing 5 mils, they're doing 10 mils, they're doing 15 mils. I asked Dr. Spiel some questions, and he, and looking at some of the stuff that's actually been published, it looks like doing a 5 mil dose and then kind of stacking it. So maybe doing 2 or 3 treatments spaced between 1 week to 1 month apart may seem to give you the most benefit with the least chance of having any negative side effects. So
Yeah.
I like to do the 5 ml dose. And if someone really wants a huge reboost, or if someone has autoimmune disease, for example, chronic kidney failure, had an MI, you really need a huge effect. I wouldn't do 15 at once. I would do 5. And then maybe once a week later, between 1 to 3 weeks later, I'd redose them with 5 again, and then again 5 again. So do the 15 mils. And actually, Doug Spiel was recommending his autoimmune protocol is 5 mils times 3 IV.
Yeah.
And potentially, depending on what's going on, he will actually inject them peritoneal. So he'll actually, get a little ultrasound and find a pocket of fluid and inject it right into you can't see me here, but I'm, injecting it right into the belly, basically around, the fluid that's around the organs in there. So he might do 3 5 ml doses IV and then 3 5 ml doses peritoneally. But
Yeah.
so that's the way that I like to give them. And I've been seeing amazing benefits through the whole body.
Yeah. Well, part of the reason why I personally chose to get intravenous, because and also why I chose to get exosomes, I've personally been dealing with back pain for the last 2 years that has just been like this one spot in my back. It's been like a dull ache, essentially, like a 2 or 3 out of 10 pain, but it's just been constant. And then that pain suddenly, like, it found its way in my hip, and like my whole, I started to get, I tried a whole bunch of things to help it, and not much was doing anything. That's why I was first interested in exosomes. But then I was like, oh, should I get the injection in my back or whatever? But then when I heard that, and it's pretty amazing. It's almost like some of the stuff sounds too good to be true, but it's just, this is the research and science that's coming out, is that they have, and you can probably explain this better than I can, but they have something called a protein ligase around the membrane that allows for this like homing function to areas of inflammation when you get the exosome injection. So the exosomes kind of like, they go throughout your blood looking for areas of inflammation, and they kind of gather there and help to recruit mRNA and protein and all these things that help to regenerate the tissue.
Yeah, absolutely. And inflamed and damaged tissues are sending a signal that they want exosomes, they want stem cells, and they alter the cells around them to start providing what they need. But most of us were too old or toxic or nutritionally deficient to be able to provide that with our own body's tissues. So they will go to areas that are dysregulated. They'll go to areas that are inflamed, and they do kind of home into those areas. And it seems like they're also homing into their targets, because so not only is there that lovely fat vesicle that they're inside, but it is kind of a membrane. It's not a cell membrane, but it contains some proteins and binding proteins that are on the surface of that will help them be recognized and taken into the cells that they're looking for. So I'm not exactly sure how they know exactly where to go. Honestly, it's pretty amazing. Nature is much smarter than we are in a lot of ways. But it appears that if there's a exosome that's supposed to go to the heart, so going back to stem cells, they did a really interesting study where they had given rats a heart attack, and then they gave them the stem cells. And what happens with stem cells when you give them IV is that because they're pretty big, and all the blood has to flow all the blood from your vein dumps into the right heart, has to flow through the lungs before it gets into the left heart, before it gets pumped out to the rest of your body. So they actually tagged these stem cells and saw where they went. And initially they spent the first 48 hours mostly in the lungs. And then you would find a few of them in the spleen and the liver. Right. And then you might find a few of them in the heart, and then they wouldn't be detectable anymore, in a patient that needed them in the heart. So they actually found that even while they were in the lungs, they were still causing the heart to grow new blood vessels and heal the scar tissue. So the effect doesn't have to be right there for the effects to happen. So it seems like they're smart. They're getting the signals from the heart. Hey, we need some assistance, and then they're sending the proper healing signals back and helping to cause those regenerative effects. So
Wow.
I'm not sure how it all works, but it seems like it does. I've actually found, so my exosome IV was about 4 months ago, and the nasal brain regenerative treatment was now almost 4 weeks ago. Actually, it was 4 weeks ago, and I'm due to do another exosome IV. I've been doing a double liver flush because I want to get rid of a bunch of toxicity, and I figured I'd wait to do the exosomes till after I did that.
Yeah.
Just, it actually is good to stress the exosomes a little bit, to stress your stem cells, but probably doing a double liver flush probably is not the kind of stress that would make them work better. Just releasing too much toxicity all at once.
Yeah, well, that's interesting. You're bringing up something that I'm sure a lot of people who have been listening at this point are curious about, which is like one, what are some of the most common conditions that you are treating with the IV exosomes, and then also like really who is this for? Because I talked about having an injury. We've talked about different patients from that other doctors are treated. Like what are some of the things that you plan to treat with exosomes, and then who can use these treatments?
Yeah, great question. So far, I've treated kind of people from ranging from their late 20s to almost 80 years old. Um, And most people are looking for that anti-aging, anti-inflammatory benefit. So most people either have something that hurts or they're just kind of starting down, starting to notice signs of aging. And I do the medical ozone in my clinic. So I take care of a lot of people with chronic disease, a lot of people with autoimmune disease.
Yeah.
And then I do the joint and soft tissue injections, and I treat a lot of people with painful chronic conditions of the joints. So I'm pretty excited about treating. I get people that want some very interesting things. Like I'm almost 80 years old and I can't sing as high. Like my voice doesn't hit those high notes anymore. I want to see if I can hit those high notes again. And I'm like, I would love to see if that's going to work for you. Um, you know, People that have a lot of toxicity. People like for me, I've always had some difficulties with liver detox. And after my IV, I found close to the 2.5 month mark that my liver just seemed to be functioning better.
Mm.
Um, so that's really interesting, kind of on a personal note. And I take care of a lot of people with thyroid disorders and a lot of other endocrine hormone type of imbalances. I think this is really promising for them. And of course, the autoimmune disease. I'm really excited to treat all kinds of autoimmune disease with exosomes. Anyone that's had strokes, heart attacks. I always tell them about exosomes.
Even
I would like to treat stroke patients. Definitely.
even vitiligo, I saw again Dr. Spiel like show one of the patients that he treated with vitiligo, and how the melanin in their skin came back to its normal, I guess its normal color, weeks after this
Yeah.
therapy. So I mean, there's all kinds of regenerative effects that these exosomes are having, and
Hmm. And that's actually an autoimmune condition too.
right.
Vitiligo is actually an autoimmune condition. So we're calming down the body's immune system that attacking itself, and then regenerating the parts that it's attacked. So like multiple sclerosis is another thing. You've got to stop the body from attacking the myelin sheaths and then rebuild those myelin sheaths.
Yeah.
Yeah, the capacity is pretty profound. And then also I just took a course in facial and hair regeneration techniques, and the idea of combining PRP with exosomes and injecting them in the face and scalp to regenerate hair, to give people, that anti-aging benefit. I actually have a lot of people that want that. They've been asking for that. And I kind of didn't want to be that doctor that did a bunch of anti-aging stuff, but I realized these aren't just people that are very vain. They're people that have been sick for a long time and they just want to look better, and they think that'll help their self-esteem, and then it'll be going along with them feeling better from their ozone treatments and their exosome treatments. And so those are great applications as well. There have been really nice. I've seen a lot of really nice results for that. Wound healing.
Yeah.
People with those non-healing wounds, people with really bad circulatory disorders, and it's been helpful for chronic kidney disease. They're actually a kind of an interesting study was they gave people with chronic kidney disease 2 IVs of 5 mils spaced 1 week apart. And then they followed their inflammatory markers. And anti-inflammation benefits peaked at 12 weeks after those IVs, but it was still sustained after 52 weeks. They didn't do anything else. And, you would imagine these patients are not the healthiest people to maintain those benefits for that long. So yeah, it's kind of like the sky's the limit. Like, what wouldn't I want to treat with exosomes? Well, that's a good question. Probably cancer,
That's
and
where
unfortunately,
that's where I was going next. Actually, is like on the inverse. What wouldn't you use to treat with exosomes? And then also, what are some of the risks associated with exosomes? That's another thing I'm sure people are curious about.
Yes. So as far as active cancer goes, that's one place where I wouldn't be comfortable doing it. And Doug Spiel actually answered my question about that. He said, unless it's life-threatening emergency, he wouldn't use exosomes in an active cancer. Now, I need to find out how long after cancer's been in remission would it be a good idea. But basically, what the evidence suggests about stem cells and cancers, and we kind of extrapolate some of this to exosomes and cancers, is that in some circumstances, depending on the cells. So if you want to take mesenchymal stem cells or master signaling cells for, they seem to definitely not promote any tumor growth. If you take some older stem cells from someone who's really toxic from their fat, they might directly stimulate tumor growth. Mm-hmm. But of course, they're supporting exosomes, and stem cells are supporting the milieu of growth development. So they have things like vascular endothelial growth factor, where they would support blood vessel growth and other things that would support growth. And so the last thing you'd want to do is have someone with cancer and give them something like this, and then their condition worsens. We don't know if it was caused by the exosomes or not, but you certainly couldn't stand up in the court of law and say, Your Honor, there's no way this could have, had anything to do with it. It's just not responsible medicine. But there's definitely more information coming out every day about that. But that being said, I hate it because people ask me and they want it, and I wish I could offer something like that. But in those cases, when people have active cancer, I tell them, well, come and do ozone. Like, that's going to be the best thing I can offer to you. And I think that'll be a great adjuvant to anything that your integrative oncologist wants to do as well. So there are some really great cancer therapies out there. Laser as well is really interesting for cancer. There's people in Tijuana doing, what's the place? There's a really big cancer center in Tijuana that, I've referred people to, because there are people doing really incredible stuff and having really incredible results for cancer. But unfortunately, exosomes is not something that I'm comfortable offering those patients.
That's good to know.
And as far as risks go, the only time I've heard about people not feeling great after exosomes, so I typically do the 5 ml dose, as I told you, and I pretty routinely hear, and I experience this myself, both with my 5 ml IV and then also with the 2 ml, brain rejuvenation treatment, which I don't inject it right into the brain. I go into this Kiesel box plexus where there's a rich nerve and blood vessel supply. It's kind of like right here. Yeah. And so they actually kind of have an opportunity to bypass the blood-brain barrier and go straight up into the brain. But they also went all over my body. I could tell I had some of the same benefits as I did with the IV, although not as much, I have to say. But I did feel like, oh, I'm kind of sleepy. So this is what I was starting to sleep. Starting about 2 days after an exosome IV and lasting somewhere around 7 to 10 days, people will say, well, I felt like I wanted to sleep more, but it was it felt like very rejuvenating sleep. It was deep sleep. I was dreaming. I woke up refreshed.
Yeah, that's one of the benefits that I've personally found since my exosome treatment. I did my treatment last Wednesday. Today's Friday, so it's about 9 days ago. And that's one of the biggest benefits I've noticed is just I've had much deeper sleep. And like you said, one of the quote side effects would be that I would be a little bit tired for a few days. Didn't notice anything for the first 2 days. Then the third day, it kind of just like me where I was like, oh wow, like it's the middle of the day and I'm exhausted. I don't know why. I'm like, oh, I guess this is what Dr. Haas was talking about, right? But that only lasted for like
Uh-huh.
3 days after that, and then
Mhm.
and then I'm kind of back to my normal energy levels, if not more energy. It's a little bit hard to
Mhm.
quantify, but what I will say is that I haven't had pain in my hip or in it's still a little bit in my back. Now it's not totally gone, but it's definitely dramatically reduced since basically for the last 4 or 5 days. So I
Mhm.
can't can I directly say it's causation from exosomes? No, but there's certainly a correlation there that I've seen the positive benefits from. Other thing I've personally noticed is just a little bit more ease in the movement of my joints, like less, like at my knee, I've had 2 surgeries on my right knee. And so,
Mhm.
of course, there's scar tissue in there. It's not
And
as,
that's not the one that you had the stem cells in, is it?
it is,
The right
yeah.
knee?
Yep. But still, even after the
There.
stem cells, there's still a
Uh-huh.
little bit of like popping, clicking, which I honestly that's one of the things where I have noticed where I'm like a little bit surprised. I'm like, oh wow, like it's just more fluid. Like it feels like it's not as like damaged in there or whatever. So those are just a
Mhm.
couple of things that I've personally noticed in the last few days, and of course, a lot of that the healing process takes place a few weeks and even up to a few months
Mhm.
after the injection. So I imagine I'll continue to see benefits as things progress in my body. One of the things that I wanted to touch on here too, and I think we've covered a good amount, but just this is a new treatment. This is a new therapy. Probably most people haven't heard much about it. What are the legalities of it? Like I'm like I said, I'm kind of like an amateur biohacker, so I was like, all right, I'm game. Like let's see what this does. I've seen all these amazing benefits from doctors online, so let's try it out. But what are there any legalities? Like I know it's there with the FDA or like how does that all
Mhm.
work?
Um, yeah. So I'll answer that question, then I'll go back to more potential side effects and cover
Okay,
that a
cool.
little bit more thoroughly.
Yeah, yeah,
But thank
great.
you for sharing your
Yeah.
experience so far. That sounds really great and really typical. And actually, I had an old shoulder injury that hadn't bothered me in years, and all of a sudden, as I was moving, I felt it starting to move different ways, and I'd felt some of those joints and tendons like just kind of clicking, and like it was opening up. So they do go to those old injuries, and you'll notice stuff happening in there for a while, and then it'll just feel really good. So anyway, my shoulder didn't bother me before; it doesn't bother me now, but I think it's a little more flexible now.
Yeah.
Um, but as far as the FDA goes, they went in and examined Chimera's lab. I think it was over 2 years ago, and they asked them a bunch of questions, but mainly, so are there any cells in this stuff? Are you giving anybody cells to anybody else? And they said no. And they said, okay, this all looks good. Are you giving any Are you giving any cells? Are there any cells in here? And they're like, no, there's not. It's not cells. It's these vesicles. And the FDA basically said, well, we're not going to regulate it. I mean, as long as you're not doing cells, you're not giving somebody a cell transplant. It's really not something that we're going to regulate at this time.
Right.
And so at this point, in order to be FDA compliant, the stem cell companies are having to go with these specific. They have to say that you're doing it a specific way, like we talked about earlier.
Right.
But that doesn't mean they're FDA approved. So for any doctor that's out there giving stem cell injections, um, none of the treatments are actually FDA approved. And we have to actually put a sign in our waiting room that says we are giving treatments that are not FDA approved in this office. Um, so as far as exosomes go, compared to stem cells, they're just safer. Like you don't need to worry about. So when I give stem cells IV, when I give stem cells, mix them with PRP and give them in a joint, I've had some pretty significant reactions of pain. I have a patient who came for stem cells who had shortness of breath, and his main reason to come see me was he'd really had some serious lung damage in the past and he wanted to get better. And he was a long way towards getting better. We did the stem cell IV, and he had a period of time for about 9 days where he was significantly worse. And, the only thing we did was the stem cells. I treated him with ozone, and we'd been nebulizing PRP and doing a lot. This guy's a major biohacker himself with his whole lab. His man lab in his garage is all like the Nano V and, his infrared light, and he's got everything. And he got himself a centrifuge so he could do his own PRP at home. I'm like, okay, go for it.
Wow. Yes.
Somebody like that has really done his homework, and, it's fun to work with people like that. But anyway, I was a little concerned about him. And then all of a sudden he was much better, and better than before the stem cells. And he got a good significant chunk of relief. But then one day, I think he was 4 months out. And so he did 2 rounds of stem cell IV. We did the 2 milliliters of the Characor. And then I think we did 3 milliliters. So it was 16. Oh, can you still hear me? Looks like something happened.
For a second there, but now you're back.
Oh, good. Oh, good. So anyway, you don't have to worry about that stuff with exosomes. I've given a lot of IV therapies. One person had a little bit of flushing. I think I may have just given it a little bit too fast. And oh, by the way, I was also running a stem cell drip at the same time. That was the only time I ever had someone react in a short-lived negative way to the exosome IV, and it was because I was kind of pushing kind of fast because we were chatting and we were buddies, and I just now I do it a lot more slowly than I did in his case. But the process really only takes about 10-15 minutes. It's a tiny little IV. So a couple other things that I've heard about happening. So other than feeling tired and getting that regenerative sleep, which I think with that time frame, it's really encouraging, because the exosomes themselves by 2 days out are actually in there stimulating your cells, and your cells are starting the regeneration process. So when do we regenerate? We regenerate while we sleep. So you want to sleep more. That's pretty consistent. I did have one gal who she did 3 rounds of exosomes spaced 3 weeks apart. And the first 2 times she said, yep, I got really tired. I was definitely letting myself sleep more. But the third time she didn't. So that was kind of interesting. It just kind of made me go, well, I wonder why that was. But she definitely noticed a difference when she did it that way. So I actually gave my mom an exosome PRP injection in her hip. So this was kind of a last-ditch effort. I didn't really expect to save her hip. So when she was about 5 years old, she got run over by a car. Her hip socket got broken, and then she was fine. Well, she turned 70, and I injected her with prolozone one time. She got about a year relief. She was walking around Malaysia. Then all of a sudden, it really started to bother her. Like she was using a cane, having a hard time getting in and out of the car. And this was a year after I did the original prolozone treatment. And so, I said, well, why don't we try the exosome? She had an x-ray. It was severe it was actually hip dysplasia and severe degeneration of the hip joint. And from all the joints that I've treated, the hip, once it becomes to that point, there's almost nothing that can get it back, whether it be stem cells or these other regenerative therapies or PRP. Prolozone. And hip surgery is generally something that people tolerate. Hip replacement surgery in someone my mom's age, make sure you get the right doctor, but it's typically something you're back on your feet and doing pretty well. So I highly encourage people to seek alternatives to surgery when it comes to knees, back, neck, shoulder. But when it's a hip and it's that bad, I'm like, well, let's just try it. It can't hurt.
Yeah.
And she noticed definitely significantly improvement right away. And when I did PRP in her knee in the past, she hurt a lot, even though I added prolozone. PRP causes a little bit of an inflammatory response at the beginning. And she was like, oh, I've made a huge mistake for the first 2 days until it started feeling better. But when you mix the exosomes and the PRP, you're actually not getting that huge inflammatory response. So she was immediately feeling more flexible, putting on her sock, walking better, not limping as much. But then about a week and a half later, she was really down. She called me and she says, oh, I've got an infected root canal. And I said, well, that's pretty interesting because she's had this root canal for some time. And
Yeah.
my thinking is that it probably was always infected, but there was so little circulation, there was so little of an inflammatory response that it didn't hurt. Because all root canals are infected. And if your listeners have root canals and they don't know this, they should probably start doing some research, because if I have a sick patient and they have a root canal, I tell them like that needs to come out, and you need to find a responsible biological dentist to do that. Make sure they take it out correctly.
Yeah.
So anyway, she had this root canal that was hurting, and being my mom, she wanted to like go on some trip, so she didn't get addressed right away. She just took a bunch of antibiotics. So, she ended up getting her hip replaced about 2.5 months later, as she had initially scheduled. I said, well, we've got 2.5 months to see what we can do. But in the meantime, she felt a lot better. But I think all those antibiotics and having the root canal surgery may have limited the benefit that she got. She might have gotten more benefit if it wasn't for all of that. But
Yeah.
I do think in a way that was a huge bonus, because we unmasked an infected root canal and she ended up getting that pulled.
Right.
And somebody else on a private Facebook group had said, oh, the exosomes caused a pelvic infection. And I think she did like 10 or 15 mils IV. I think it was 10. And I have heard about people, not my patients, because I only do 5. I mean, I'm willing to do more, but I don't really recommend it. I don't see why you would do that when you just might as well space them. Because by the way, 1 5 mil dose of the Chimera exosomes, the Exoglow product, is kind of the equivalent of what 160 million live MSCs would secrete in a 24-hour period. So why would you really want to do double or triple that all in one go? Like, doesn't really make sense to me.
Yeah, you're getting a huge
So
dose.
she said, oh,
You're getting a huge dose of the exosomes, right? Like when I hear about some of these stem cell treatments that are out there, what I hear is like, oh, they're doing like 40, 60 million stem cells. Some of them more expensive ones, 100 million stem cells. But you're getting, with the exosomes, you're getting this equivalent of 160 million mesenchymal stem cells. So you're just getting a pretty large dose with just the 5 mils. And yeah, to do more, I mean, who knows? Maybe it has benefits, but like from what you're saying, and from the other things I've seen, it seems like 5 mils is a great place to start.
I think it makes a lot of sense to me, and it's not exactly the equivalent. But what they did was they studied how many exosomes these MSCs would secrete in a 24-hour period if they were alive under good conditions. And so, like you say, you're kind of comparing apples to oranges. How long did the MSCs actually live when you inject them? How many of them are actually alive when you inject them? So to me, if you can get 160 million would do in one 24-hour period, why would you do it more often than once every 24 hours? I mean, you could do it day 2, day 3, but like, why all at once? I don't understand. It's silly. You could just come back the next day and do it again. Anyway, so that's just me. That's my little rant. But anyway, she said, oh, it caused a pelvic infection. And when I heard about this case, I thought, well, she probably already had a pelvic infection, kind of like my mom probably had a root canal infection. I don't think this is going to cause an infection. It's just going to unmask an infection. Your body is very good at walling off toxicity. So unfortunately, at this day and age, we're very toxic. We have tons of toxins. We've been pushing things down with antibiotics, with vaccines, with Tylenol, with nonsteroidals. Every time you take something to suppress a symptom, it's actually keeping from healing the natural way that it would. Pus, diarrhea, phlegm, those are ways your body get rid of stuff. When we get the chicken pox, those little itchy, scabby things, that's like our body's getting rid of those dead cells that got invaded by the virus. Like, we want to get rid of it. We don't want to take something and push it deeper into our tissues. That's really the only alternative. So maybe she had gotten some kind of pelvic inflammatory disease and went on antibiotics when she was younger and thought it was gone. And there was just a walled off infection in there, So I think any of the risks involved are really just, due to heavy toxicity loads or, hidden stealth infections, that sort of thing. And one more thing I definitely want to touch upon is between stem cells and exosomes for people that have chronic disease like Lyme disease. So stem cells are a whole cell. They have the whole cell membrane. They have a lot of cytoplasm. They have the endoplasmic reticulum inside. They have all kinds of stuff. And they can actually be infected by different viruses, like viruses of the herpes family, maybe Lyme disease. And of course, they're testing the donors for HIV, hepatitis, syphilis, and West Nile virus and some of the herpes viruses, I believe, HHV6. Well, actually, I don't know I think they're testing that for that. I hope they are. And so they have a list of things, but they can't test for everything. And so there have been people who've had a stem cell infusion and said, oh, well, it reactivated my Epstein-Barr. I thought that was totally under control, or it was mildly controlled or better controlled, and then it got worse. So we know that stem cells and exosomes do have an effect on the immune system in general. So that is a potential risk, is having your immune system shift over to a point where if you had a brewing infection, that could potentially, become unmasked. But I think people have had that effect with stem cells, and they've reported it on a lot of these private Facebook pages, but it really hasn't been a problem with exosomes, even though, we've now been doing them for 3-4 years with Chimera's exosome products. Tens of thousands of doses have been given, and we really haven't seen that. So it does affect the immune system, but it seems like it affects in a positive way. So it's when you start feeling symptoms, that means your immune system's actually working. From really our Western standpoint, but there's a lot of doctors that are waking up to the fact that, Hippocrates was right, or, these Chinese doctors and these Ayurvedic doctors were right. Like, you don't really want to suppress a fever. Fevers can cure like Hippocrates actually said, make me a drug that can cause a fever, and there's no disease that I can't treat. So pretty profound stuff. But here we are giving our kids Tylenol, our babies Tylenol and that sort of thing. So anyway, is that clear? Did I make that kind of clear-ish? Your listeners might want a little more clarification about that.
No, I think that was really, really helpful in kind of giving a full overview, right? Because we don't want to just share all the benefits for things, because then people think like, oh, this is a panacea, or it's something that sounds too good to be true. And there are some pretty miraculous and amazing things that are happening with exosomes, but also it's fair to share the potential downsides and risks as well. And I think we well covered that. And so what I would say at this point is we've gone through a whole bunch of things. Is there anything else that you really want to touch on around exosomes before we wrap up? Because obviously you and I are friends. We could talk all day about this stuff, and we do. When I come to see you in your office, we have really good conversations, and that's part of why we had this interview, right? So, but I just wanted to see, is there anything else you wanted to share on the topic before we wrap up?
If people want to learn a little bit more, I am doing a video blog on my YouTube channel where I've talked about my experience with my exosome treatments. And if anyone has questions, maybe we can post this in a forum where we can answer those questions, because I'd definitely be happy to answer more questions as they come up. I think it's an exciting thing. And like you said, I could talk all day about my experience. I think these are the stem cells of the future. When people come and they want stem cells, I tell them, well, have you heard about exosomes? Like, actually, that guy with the lung condition came back and he said, I'm going to do a fast. I want to do another round of stem cells. And I told him about exosomes, and he's like, okay, let's do the exosome. Like, he went and did all his homework, and he's like, oh yeah, let's do the exosomes instead. Yeah. So, I think that, the landscape is changing. I think, 5-10 years from now, we're going to hear a lot more about exosomes and stem cells. I'm excited about them. And, they've really done a lot for me personally. And I think anyone that's looking to optimize their health, like, aging is optional. We have so many tools in our tool belt now that we can use. And it's just a really exciting time to have this opportunity to share this information with more people. So I'm grateful. Thank you, Matthew.
Yeah, thank you, Dr. Haas. And just one more thing before we let you go. Dr. Haas has been gracious enough to offer, a special discount to anyone who has seen this interview and mentions that they, either my name or just mentioned that they saw the interview. And she's going to offer $200 off of an exosome treatment for those who are interested. And actually, it'd be great, Dr. Haas, if you could just share what the best way is to contact you or your office so that people can get in touch.
Excellent. So my practice is called Flourish Anti-Aging Medicine. I still need to update my website. My website is www.flourish, Flourish, MD, medical doctor, acupuncture, ACUPUNCTURE.com. I made it really easy for you. And you can actually give us a call. That's the best way. But go check out our website. I have some information on stem cells and exosomes and the ozone treatments there. Our office number is 619-752-4191.
Awesome.
Happy to help y'all out and take advantage of that the discount. We have packages on if you want to do 2 or 3 of the 5 mil IVs. There's package pricing discounts as well, and I have all kinds of stuff on the website. And my assistant Hannah is great over the phone, so she can answer any questions you have, or you can even set up a free 10-minute phone consult with me. So, love to take care of you real soon.
Awesome. Well, thank you so much, Dr. Haas. Really appreciate your time, and I hope some people got some really great information out of this interview, and that they'll take you up on that offer. And yeah, let's maybe find time to do this again. And just this was great. Thank you.
Yes, this was great. Let's do it again. Many blessings to you. Have a great day.
You too. Bye.
Bye.